Parth, if you had your own hair naturally growing back and you didn't, which would you choose if all factors were not involved? And I honestly would answer, Dr. Niraj is also a client of the process. Can you share from your perspective as a patient
how you felt at our clinic, how you feel about the transplant and what you expect?
Hey Meridesi Bhayo and brothers, welcome to my channel aimed to support you to lead healthier and happier lives with practical tips that I wish I knew to fuel your wellness journey. In this video, we'll review part 2 of my interview with Dr. Niraj Goenka, where we will discuss home care products to prevent hair loss, what you can expect after the hair transplant, and his own journey being a patient, and much more. Keep watching.
Can you speak a little bit about your experience, your perception of some of the products that are out there?
That is definitely a very good question, and people should know about it. Most of the time, most of the products, they are marketing gifts. They are money-making business. I'm not saying all the products, but most of the time they try to take the money from the people by giving long, big hopes to the patient. But in reality, most of the products, they don't work. So before using any product or anything on your scalp, on your body, first research properly. Don't just jump into it. And when in real need, just go to the doctor and consult about the products and then start using. This is my humble advice to the people using all these marketing products.
And it's so true because you all probably know whenever you put something on your skin, it goes directly into your bloodstream. So you want to be really careful about what kinds of products and chemicals, hopefully organic materials or organically sourced products that you use is what you want to prefer. Dr. Goenka, can you talk a little bit about, like, after the hair transplant procedure, there's 6 months of, I think, minoxidil, and then after that, can you recommend any kind of shampoos? There's a lot of shampoos and a lot of hair care products that have all sorts of parabens and chemicals and things like that. Can you speak to that a little bit?
Yeah, after transplant, you just need to be very gentle. Not even the transplant. With the hairs, you should be gentle enough regarding your shampoo. This should be very mild shampoo, paraben free. You can use your own shampoos, but don't change the shampoos repeatedly on people's advice. You can take a doctor's advice. Don't use shampoos too frequently. Once or twice a week is sufficient. And then eating good healthy diet. Avoid bad habits like smoking, alcohol. Taking care of the sun. If you go out in too much in the sun, try to cover your hairs and everything. So taking small care, avoiding the products like waxing, coloring, dyeing. So much of the products available in the market, but most of them is harmful. So avoid using all the styling gels and all this stuff. And avoid binding hair too tightly. Be gentle. This is my advice. Be gentle with your hair. This is an organ. This is a part. They are nature. They are life.
Dr. Niraj, can you share, because Dr. Niraj is also a client of the process. Can you share from your perspective as a patient from before you even had your own process? If you haven't seen my first part, you want to see the first part, because when I looked at Dr. Niraj, I was like, I want to look like that. Can you share a little bit about your patient journey? What was that like for you?
So definitely as a doctor, I know everything, how it goes. But when I'm on the chair, I'm as a patient, I was a little bit nervous before the procedure, same as other patient, but definitely I was knowing what to say. So I was not that nervous, but as a patient, I was a little bit nervous. I had gone through 2 procedures. One is 10 years ago. There was a frontal baldness 10 years ago. I did a small procedure. It was around 2,000 grafts in front. But later on, I lost almost the whole area after maybe a few years. Again, 3-4 years. This from now, 6 years back, I did the second surgery. At that time, I put almost 6,000 grafts in 2 days ago. So I completed this procedure and I'm really happy to get all my hairs back. It works very well. My confidence, as my job perspective, as a person's perspective, as a social perspective. I'm very happy after doing transplant as a patient.
You brought up a really great point about confidence and how clients can feel before and after. It's interesting because I was very trepidatious of this process done, to be honest. For years, I've been contemplating, should I not? Should I just self-generate my own confidence? Can you share about your patients, the patients that have come to you, how they feel about themselves 6 months later or 1 year later? Anything on that note?
Yeah, before the procedure starts, patients are very conscious. Some people, they don't know about transplant. And the people who knows about transplant, they have so many questions in their mind, whether hair will grow back. What am I expecting? Is it worth it? so much pain, so many patients, and there are so many huge side effects. The patients have so many concerns. But once we give all the information when the patient is prepared, yeah, in beginning, few minutes of the procedure, there may be a little pain, but as the procedure goes, patient is very comfortable. And once the procedure is done, patients say, oh, that was the pain? That was not that much. So patient is happy after the procedure. And as the time goes, as I said, it started falling after 2 to 3 weeks, and most of the hair falls after 1 month. Then patient is again conscious. But as the time goes, as the hair start growing, patient get a little confidence. And after 7 months, patients is really awesome. Most of the patients are confident enough. Some patients who are not getting married, they get married because of hair. So there are so many positive things. Their job perspective, social perspective, confidence perspective. So most of the patients are really happy after transplant. And as a doctor, we are also happy when the patients are happy. And yeah, but I did your transplant. I got a very good patient in terms of Parth. How you felt at our clinic, how you feel about the transplant, and what you expect.
Prior, I'd seen Dr. Niraj twice. I met with him once and brought my family with me as well, because if you're going to do this and you're close with your family, it's always great to have them be involved and to have this be a discussion. If you're not, you don't necessarily have to. But I met Dr. Niraj first with my mom. As I was mentioning earlier, when you had shared with me that you had gone through this process,
Okay.
that sold me. Because for me, I tend to gravitate towards people who are really authentic, who keep it real, and who've gone through their processes themselves. So you had done that, you had walked the talk.
Right.
And
Sure.
so honestly, that was like me 60% already in. And then I'd also been, and y'all always see this in my part one video, I also had to do some deeper self work within myself. And I think you asked this brilliant question. You said, Parth, if you had your own hair naturally growing back and you didn't, which would you choose if all the factors were not involved? And I honestly would answer, that would be great. How do I grow my own hair back? Going through my own internal journey, I kind of had this limiting belief, or maybe I was attached to a belief that I wanted to be very spiritual, and why am I attached to these worldly things and these materialistic things? I don't want to be judged by my hair, and all these kinds of internal dialogues I was having. But again, if I was given a choice, and at this point in my life, honestly, I wish I would have done this earlier. So that was my internal journey.
Yeah. Till you don't have hair, you accept it, that's fine.
So just having these conversations with you were really valuable. And during the procedure itself, as I mentioned, I fell asleep during the procedure numerous times.
If you're confident on the doctor, you say everything is going well, then patient sleeps very well.
And I went through 4 processes, 8 to 10 hours, 8 to 10 hours, another 7 hours, another 7 hours.
Yeah, we did almost 35 hours of the surgery, divided in 4 days. First day almost 8 to 10 hours, second day again 8 to 10 hours, then 6 7 hours, 6 7 hours. We did 4 times because it was a huge number of graft. Second thing, your donor was not that good. We took so much from the beard, we took so much from the triple areas. So it was a little difficult, but ultimately we got it. On our side, we did our 100%.
And you guys they did such a great job after the third follow-up visit. I thought, well, I still have another area in the bald area, like in my bald spot area. Could you fill that in? And you were able to by taking some portion from my beard and what was left of my donor.
Yeah, first we thought that we will not be able to take question of nails, but ultimately we found that we can get few more here to fill that gap also. So we did it. And one more thing I forgot to tell you that after transplant, generally we give some medications till 6 7 8 months for maintaining your existing hairs as well as helping the transplant growing back. Once you grow all your hairs back, then you may need medication for existing hairs, whatever you had before surgery. But mostly the transplanted hairs, those fall for many years, sometimes for a whole life. But your existing hairs, you were having earlier, they may fall. So you may need medication as long as you have your own existing hairs. So you may need it for a long time also.
That's based on your own personal genetics and your own personal lifestyle. Wonderful. Is there anything else that you would like to share that you think would make a difference for our Desi brothers out there?
I would like to tell the people who is listening, first of all, if you have some concern, do the research part of you. Just don't jump into something which is just marketing kind of thing. Don't go and fall into gimmicks or money making this. Go to the right doctor at the right time when you are in need. And at home, eat healthy diet, take care of your hair, be gentle with your hairs, avoid smoking alcohol, and take care of your hairs and health. Thank you.
And Dr. Niraj, are there any precautions or side effects that patients can expect after having gotten a transplant procedure?
Yeah, but after each procedure, each surgery or procedure has their own minor side effects or something. So after the procedure, we tell the patient to have some precautions, like don't touch the planted area. Be careful while sitting. We give some sprays to spray on the hairs, like for 5-6 times a day. Avoid sun, avoid too much vigorous activities like too much gymming or exercising, maybe week or 10 days. This is about the precaution part, and take the medication what the doctors advise. This is about the precaution one. And what side effect or what the things can happen after transplant. Immediately after transplant, there can be a little itching, mild discomfort. Or one more thing that can happen is a swelling. Yes, some people are concerned about the swelling. This is known as post-operative edema. Sometimes it comes on your forehead or eye, but that is normal. This is known as post-operative. Then goes by on its own by 3-4 days. So there is generally no major side effect, but there are minor side, itching, burning, pain, some boils, some acidity kind of thing that can happen first 5-6 days. Then as the time goes, everything goes on its own, and we use some medications like painkiller, antibiotic for first 4-5 days to calm them down. So hopefully the patient goes very well, and the side effects are very minimal and very less.
Sure. For me, the antibiotics were really helpful because I did feel some pain and there was a lot of itching, but that meant that everything was working. So thank you for reassuring me on that aspect. Dr. Niraj, do you have any advice for anyone who's considering going through a hair transplant?
Yeah, definitely, Parth. Most of the time, what happens is patient goes through internet or some news or some media. They sometimes choose the doctor from the marketing side. But I want to tell the patient, go and do a research about doctor as well as clinic. The best way is doing research is recommendation. If you have someone to ask for, how about the clinic, how about the results? First of all, this is the thing. Second thing, when you go to the doctor, most of the time what happens is the patient asks us, how many grafts will you put? So this surgery is not only about the grafts. It's not about the 3,000 or 6,000. It's not only about the graft, the surgery. There's so many things into it. It needs a huge skill, creativity, good density. There are so many things. A good hairline, plate making, extraction, good implantation, good density, naturality. There are so many factors. So it's not just the number of grafts. Most of the time patient just asks, sir, how many grafts will you put? This much, this much. So this is not only the graft, it needs so many things and so many good skill for a good result. So do research properly, use the recommendations of the patient, and go to the right doctor before choosing any clinic or a doctor.
Thank you. And Dr. Niraj was actually recommended to me by my father's physician, and that's how I actually came to learn about you.
Yeah. Thanks, Parth, for being such a good patient. Thank you.
Mere desi bhayo and brothers, if you found this video helpful, be sure to like and subscribe and turn notifications on for future videos. And if you haven't seen part 1 of my interview with Dr. Goenka, then be sure to check the end screen here and the full playlist of videos here. Stay tuned for more videos on men's health and wellness. Peace and love, and be well. Remember, change your state, change your results, change your life.